Coming back to one of our top stories today, thousands of tons of polony and other cold meats will be sent to dump sites following the deadly Listeriosis outbreak. Health Minister Aaron Motsoaledi and the National Institute of Communicable Diseases, the NICD, on Sunday announced that the source of the present outbreak was an enterprise foods facility in Polokwane. Well, Listeria has also been traced to another enterprise facility in Germiston in the East Rand and a Rainbow Chicken facility in the Free State. Well, since then, a massive recall of all products identified with the Listeriosis outbreak has been underway, and these products then have to be disposed of. But how can this be done safely without putting people at risk? To tell us more is a treatment and disposal specialist at EnviroServ Waste Management, Dr. Johan Schoonraad. Thank you very much for joining us and welcome to you.
Thank you, Peter.
All right, so, for us, it's just cold meats, but once Listeria gets into the equation, this is now hazardous waste, isn't it?
That's correct.
All right, so what do we do with hazardous waste if we see it in the fridge? What's the first steps that a consumer at home should be doing?
Well, the industry has already put together a plan. So they're saying, bring it back to the retail store that you bought it from and they will take it off your hands, which is the easy answer right now. So that's then out of the community and there's no more risk to the community.
So what they shouldn't do is put it in the bins or try and dump it themselves. Why?
Correct. Because if they dump it in the municipal system, it ends up at municipal sites where there's very poor access control, and inevitably that material will then be picked up, scavenged by the informal sector operating on those municipal sites.
And then that just perpetuates the problem, recycling the problem essentially.
Precisely.
All right, so once they take it back to the retailers, that's where people like you step in. What
Correct.
do you then do?
Well, we have two options as a waste management industry. The premier option would be incineration. Unfortunately, in this country, we have a limited capacity for incineration. The bulk of that industry is focused on medical waste incineration, the destruction of healthcare risk waste. And they've built and sized their capacity to that industry. So when you now suddenly approach them with a problem of this magnitude, they certainly don't have the capacity to deal with this material. And that's why we as EnviroServ said, well, landfill is an option. We can chemically treat this material to destroy the bacteria and then trench and bury it so that it's inaccessible to anybody ever.
All right, well, tell us about this chemical treatment. What do you put on it? Is it?
There's a host of materials you can use, and the literature is full of all sorts of disinfectants. The easy one to use is lime. Lime actually breaks down the cellular structure of the bacteria and then they die.
All right, and then these dump sites, is it deep so that nobody can, find themselves in these sites and exposing themselves?
Well, I'd first like to correct you. We call them landfill sites, not dump sites.
Landfills, not dump sites, okay.
A dump site is one of these informal places where people really go and dump their garbage. So these are landfill sites. So they are highly engineered facilities. And when you're talking engineered hazardous waste landfill sites, we have very strict access control. So nobody can get onto the site that doesn't belong there. And then you're correct. We certainly deep trench the material so that it's not accessible to people once it's covered and the site is then inaccessible.
Just how much, do you have any idea in terms of the size of the problem, in terms of how much waste you're going to have to deal with?
Well, confirmed numbers right now, about 4,000 tons.
Wow. But you can deal with that quite easily.
Very easily.
Okay.
For us, that's an insignificant number.
So the only issue really now is just to make sure that people bring this stuff in. And have they been cooperating? Have you?
Well, what we've done is obviously approach the industry because they've set up the collection system. We're saying we can provide the solution, and we are relying on the food industry to do, let's call it the difficult part, which is actually bringing the material into a single point, and then from there on we can take it and deal with it.
All right. I am a nervous character, so I'm just imagining rain coming down on these landfills and the water sort of seeping through. Are we safe, totally safe from stuff that's been put in landfill sites?
Absolutely. So again, this is the difference between an engineered hazardous waste landfill site. It's got all of the engineered linings to make sure that nothing leaches out, nothing leaks out of the site. It's totally contained on the site, it's immobilized, and rainwater then, even if it does impact the site, is collected and dealt with. It doesn't escape into the open environment.
All right. So typically, what else have you been putting in these landfills?
It's a range of chemicals from industry. It's a
Yeah.
range of chemicals from, you name the industry, and we deal
Yeah.
with it.
Okay. All right. Okay. So you are going to safely deal with this. We don't have to worry about it. What we need to do is just make sure that we take it to the retailers. Don't put it in the bin. Don't try and dump it yourself. What about people who are going to try and incinerate it themselves?
In their backyard?
Yeah.
Bad answer.
Okay.
The problem with home backyard incineration
Yeah.
or informal
Yeah.
combustion is it's poorly controlled. You have very poor mixing during this combustion process.
Right.
And essentially you're releasing particulates, smoke in a sense, to the atmosphere, which could carry these bacteria even further than your backyard.
Okay, so don't even try and burn it yourself
Don't
either.
do that one, no.
Okay, all right. So we're going to leave it there then. Dr. Johan Schoonraad, thank you very much indeed for your insights. And yeah, we wish you the best in terms of making sure this problem goes away. Thank you so much for your time.
Thank you, Peter.